Hi, my name is Diego Rivero, and today on this episode of my podcast, I'm going to be continuing on talking about generalized anxiety disorder. So, as you guys may know, this is going to be part four of the series of podcasts that I'm doing about generalized anxiety disorder. So, as you guys may know, last episode I was talking about cognitive behavior of GAD, which is generalized anxiety disorder. So, on this episode, I'm going to be talking about the second theory. The second theory I'm going to be talking about is a biological perspective of generalized anxiety disorder. So, let's go right to it. So, the biological perspective of GAD suggests that the disorder has a strong genetic and neurobiological basis. Research indicates that GAD may be linked to dysregulations in brain chemistry, as well as the functioning of specific neural circuits that are involved in emotional regulation and fear processing. This viewpoint emphasizes the role of genetics, brain structure, and neurotransmitters in the development of anxiety disorders. So, let's go into some key components of the biological perspective of GAD. So, the first one is genetic factors. Genetic factors. Evidence suggests that individuals with a family history of anxiety disorders are more likely to develop GAD, indicating a genetic predisposition of it. So, twin and family studies have shown that the heritability of GAD is significant, with estimates ranging from 30 to 40%. When I saw that, I couldn't believe it. That is unbelievable. I know I made the same analogy on one of my last videos, but 30-40% is a lot. Like, if you compare it to like the population of the United States, which is 380 million, it's a lot. It's millions of people. So, the genetic factors may contribute to the way the brain processes anxiety related information, making individuals more susceptible to excessive worry and fear. So, the second part is neurotransmitter imbalances. So, the biological perspective emphasizes the role of neurotransmitters such as serotonin, gamma aminobutyric acid, which is also called GABA, and neuroprophene. In the regulation of mood and anxiety, research suggests that individuals with GAD may have imbalances in their neurotransmitters. For instance, a deficiency in GABA, which acts as an inhibitor neurotransmitter, may result in heightened nervous system activity and an exaggerated stress response. Similarly, dysregulation in serotonin or neuroprophene pathways may contribute to the emotional and physical symptoms of anxiety. So, number three, brain structure and function. Brain imaging studies have revealed that people with GAD often show altered activity in areas of the brain involved in the regulation of fear and anxiety, particularly the amygdala and the prefrontal cortex. Prefrontal cortex. The amygdala is responsible for processing emotional responses, particularly fear, while the prefrontal cortex is involved in regulating and inhibiting emotional responses. Dysfunction in these regions may lead to heightened fear response and difficulty in managing anxiety, which is a characteristic of GAD. So pretty much what I was saying is just like a chemical imbalancement in our minds that unfortunately some people like this perspective is saying that some people maybe have an imbalancement, a shorter amount than what a person without GAD may have. So we're gonna be talking about now, after we know that there's a perspective about an imbalancement. Now I'm gonna talk about some ways to treat it. So some treatments according to the biological perspective. The biological approach to treating GAD frequently uses pharmacotherapy to restore balance to brain chemicals. Patients with GAD are frequently treated with selective serotonin reuptake inhibitors, which is also called SSRI. Serotonin, serotonin norepinephrine reuptake inhibitors, which is also called SNRI. The medications work to reduce GAD symptoms by regulating brain neurotransmitter functions. The long-term use of medication carries risk of side effects, which is why it is generally discouraged by combining medication with therapy and could and but combining discouraged but I'm sorry, which is why it is generally discouraged, but combining medication with therapy can provide the best results. So, a comparison of the cognitive behavior and biological perspective. While both the cognitive behavioral, and biological perspective offers useful explanations for the development and maintenance of GAD, they differ in their underlying assumptions and treatment strategies. So, my focus of explanation, the cognitive behavioral perspective focuses mainly on the individual's thought patterns and learned behaviors, suggesting that anxiety is driven by irrational thinking and mad and like mad and bad adaptive coping strategies. Like just bad adaptive coping strategies. Now, from a biological standpoint, the focus is on genetic influences and brain chemistry, as well as neurobiological elements that make GAD emerge because of built-in biological tendencies and brain circuit malfunctions. So, pretty much in simple terms, the main difference is just cognitive behavioral is more about learning bad behaviors, and like you dealing with those bad behaviors, you start adapting, like we said before, really bad strategies to try to cope it. But at the end of the day, you're not coping, you're just hiding it to make it worse, and that can affect you in the long term. While biological is pretty much saying that you're born with an imbalancement. Like I stated before, pretty much just an imbalancement in our minds, in our bodies, of certain chemicals, which can be treated, but unfortunately, medication is not a magic pill they can take and everything will go away. Some people respond to it differently. Some people may need higher, some people may need lower doses. There is not just a pill that's gonna fix all the issues that you may have. That's why medication, like I said before, goes well. The correct medication for you specifically, because it's not a one size fits all. Everybody's built differently. Everybody has a different advancement. So that's why when you mix medication and therapy, that's when usually you get the best results. But it also depends on the person. If you're the type of person that doesn't like taking medications, then just stick to therapy. And if you see the results coming off of that, then stick to therapy. But if you don't, you feel like you need a little more of something, then take the medication. Try it out. Test the waters. Get a good doctor and try it out. So a treatment a treatment approach. In terms of treatment, CBT seeks to change the individual's cognitive and behavioral patterns through psychotherapy, such as cognitive restructuring and exposure therapy. The biological approach typically relies on pharmacological interventions to correct chemical imbalances in the brain, with medications like SSRI and benzodiazepines commonly prescribed. Interdependence of both perspective. This is mine. Multiple experts in research and clinical practice hold a view that the two perspectives can coexist. In fact, they may work in tandem. People who inherit anxiety tendencies often create disordered thinking patterns and ineffective coping methods when exposed to environmental stress according to CBT principles. Treatment for this condition combines cognitive behavior therapy, which tackles unhelpful thinking patterns, with medications can assist in regulating brain chemistry. So, a conclusion to all this is the complexity. Generalized anxiety disorder is very complex. It requires so much data from multiple theoretical perspectives for a more complete understanding of it. The cognitive behavioral approach reveals how dysfunctional thoughts and behaviors both produce and sustain GAD while providing therapy strategies for effective treatment. From a biological standpoint, the development of GAD is linked to genetic factors and imbalances among neurotransmitters together with structural brain differences, while underscoring pharmacological interventions as crucial treatment methods. An integrated perspective can enhance our understanding of GAD by acknowledging the relationship between biological factors and cognitive behavior process. When clinicians merge findings from both theoretical approaches, they can create more personalized treatment strategies that effectively manage the disorder's diverse aspects and ultimately being able to help each person to the best possible way to their own way. Alright, I know that was a lot that I said, a lot that I talked about, but I really hope you enjoyed this episode. If you have any questions, please let me know, and I'll see you in the next one.